How to Protect Patient Privacy in a Community Setting by Stanley Tran, Howard University, class of 2016. This is my API community rotation, second rotation slot, and today is July 9th, 2015. As a disclaimer, we accept no liability for the content of this video or for the consequences of any actions taken on the basis of the information provided. HIPAA is defined as the Health Insurance Portability and Accountability Act of 1996, which employs different measures to ensure data privacy, data security, and data breach notifications. HIPAA employs steps to ensure the privacy of all patient information, the security of data stored or transmitted electronically, and to notify patients when there has been a breach so they may take the necessary steps against identity theft. Protected health information, otherwise known as PHI, includes name, street address and zip code, date of birth, patient age, telephone, fax numbers, email addresses, health plans, Medicare or Medicaid ID numbers. Vulnerable PHI can be defined as PHI that can be read, used, deciphered, or accessed by unauthorized individuals. These include whole pieces of paper, unencrypted files such as email, hard drives, flash drives, tapes, and DVDs. How to protect against HIPAA violations. Patients should keep their distance, establish boundaries in the pharmacy near consultation areas. Ask patients if they have ever taken this prescription before, and if they want counseling. By avoiding counseling, you can eliminate an avenue for unnecessary patient exposure and ensure to keep voices low while counseling. Make sure all materials containing confidential information are concealed and all computer screens are facing away from patients and possibly covered with privacy screens. Why should we not bag prescriptions in the pharmacy? Pros: reduces errors in medication dispensing, allows the pharmacist to verify medication count in front of the patient to reduce complaints. A few cautions with not bagging prescriptions: ensure the prescription is not visible to customers who are not related to the patient who is picking up the prescription. You want to make sure to keep voices low so that surrounding patients cannot hear any personal information / medication names. Penalties for violating HIPAA. Violating patient privacy can potentially lead to costly fines from the Health and Human Services for divulging patient information. HIPAA violations actually occur fairly often, and they are common. CVS, the largest retail chain, just recently paid a $2.25 million settlement in January in order to resolve complaints of inappropriately disposing PHI, such as medication labels from prescription bottles and old prescriptions. More specifically, CVS failed to implement adequate policies and procedures to dispose protected health information and failed to train employees on how to dispose of protected health information, as well as did not maintain and implement sanctions for members of its workforce who failed to comply with disposal policies. And in conclusion, by integrating policies to eliminate the potential for HIPAA violations, such as not bagging prescriptions, patients' protected health information will be secured and customer satisfaction will improve, resulting in increased revenue and reduced risk for HIPAA violations.